Guys, at a cellular level, let's look how corticosteroids work. Okay. See, corticosteroids, what they do, actually almost or every cell it will penetrate. It will have a cytoplasmic receptor protein almost in all cells. Almost in all cells this will be there. So, all the cells will pick up corticosteroids. Then this steroid receptor complex will have a structural change and it will migrate into the nucleus. Okay, migrate into the nucleus. It will migrate into the nucleus, and the glucocorticoid response on the chromatin transcription, mRNA, regulation of protein synthesis. Okay, you got it right. It will have a cytoplasmic receptor. It will then enter the nucleus. Nucleus DNA will become RNA. RNA will give protein synthesis. That's all. Over. Let us look at some specific actions of glucocorticoids. Carbohydrate metabolism, protein metabolism. See, basically it is very catabolic. Okay, it is catabolic. So what it will do, it will want to break everything on earth, correct? So protein breakdown. It will inhibit glucose utilization by peripheral tissue. So glucose level will increase. So precipitation of diabetes will happen. Fat metabolism is lipolysis. Calcium metabolism, you have seen osteoporosis, lot of renal excretion of calcium. So your body is going to lose lot of calcium. Okay, osteoporosis can result because of that. Water retention will happen, sodium water retention. In cardiovascular system, you have seen water retention, hypertension, raise in BP, hypertension, both are same. Skeletal muscle wasting happens due to hypokalemia in hypercorticism. Even hypocorticism will cause muscle wasting. Skeletal muscle weakness will happen. Then coming to CNS, euphoria, mild euphoria, steroids, they will cause euphoria. Psychosis, they lower the seizure threshold, so you should not give an epilepsy people. Okay. Stomach, it will increase gastric acid secretion, so peptic ulcers can become more. Lymphoid tissue and blood vessels, see, it will remove lymphatic cells, malignant lymphatic cells, it will lyse. That is why they use in lymphomas. Okay, malignancy, especially lymphomas, they will use glucocorticoids because they lyse only those lymphatic cells. Okay, but RBC, platelet, neutrophils and all increase. Fine. Inflammatory response, it suppresses inflammation. It is a non-specific suppression. How does it do it? Limitation of the inflammatory, recruitment of the inflammatory cells will be less, and also there will be less production of pro-inflammatory mediators like prostaglandins, leukotrienes, platelet activating factors, etc. Indirect inhibition of phospholipase A happens. If phospholipase A is inhibited, what will happen? Arachidonic acid will not be formed. You remember all that? So phospholipids which are present in the cell membrane, they cannot convert to arachidonic acid. Arachidonic acid hence cannot convert into prostaglandins, leukotrienes, etc. All these prostaglandins, leukotrienes, PAF, that is platelet activating factor, these are pro-inflammatory. So if you suppress them, the inflammation will be suppressed. Did you understand? It's very easy if you are awake. Glucocorticoids, they reduce inflammation. So they reduce inflammation, and the next thing is immune suppression. This also you should not forget. Immune, if you have any hypersensitivity, allergic reactions, okay, because of some pollen grains, whatever, glucocorticoids will suppress the hypersensitization, allergic phenomena. It will impair immunological competence. It will suppress the recruitment of WBCs, leukocytes, and at the site of contact with antigen, even the inflammatory response will be suppressed. There is greater suppression of cell mediated immunity. So this is what is your trick here. Cell mediated immunity, it will suppress more. So what will happen if it suppresses cell mediated immunity more? The delayed hypersensitivity, etc. will be suppressed. So there will be less graft rejection. So before organ transplant, they will give high doses of glucocorticoids, and afterwards also they will give some low maintenance doses. Okay, so you should know this. Organ transplant, all these are key words for you in your exam. Please note this. Okay, Immunologic suppression, suppression of immune suppression. Okay, got it? Very good. Now let's move on. Okay, so that was it with the actions. So we are done with the actions, guys. So we saw the mechanism of action. It will enter almost all cells. There will be cytoplasmic receptors. Then it will enter the nucleus, make the DNA become RNA. RNA will become protein synthesis. Normal mechanism. It will break down protein. It will break down fat. It will make sure that glucose is not taken up by the peripheral tissue. It will increase glucose level. Glucocorticoids are catabolic. They increase excretion of calcium, hence they will cause osteoporosis. Water retention, hence there will be edema, rise in blood pressure, hypertension, etc. In cardiovascular system, again I told you the same thing. Skeletal muscle wasting or muscle weakness happens because of hypokalemia in case of hypercorticism. Even in hypocorticism there can be muscle weakness. CNS, mild euphoria can be there, psychosis, and it will lower the seizure thresholds. Stomach, there will be increased gastric acid secretion, so peptic ulcers will become more. So it's a contraindication. Don't give it to people who have peptic ulcers. Lymphoid tissue and blood cells, there is marked lysis of malignant lymphatic cells. This is a very good thing. Hence you can use in lymphomas. So if somebody asks you, why will you use glucocorticoid in malignancy? You will use glucocorticoids in malignancy because they are able to lyse malignant lymphatic cells. Not all types of cells, only lymphatic cells they can lyse. However, RBC, platelet and all, it will increase the count. Understood, right? We are moving on. Inflammatory response, it will suppress inflammation. It will limit the recruitment of inflammatory cells, and also it will reduce the pro-inflammatory mediators like prostaglandins, leukotrienes, platelet activating factors, etc. It will inhibit phospholipase A, which will phospholipase A actually converts phospholipids into arachidonic acid. Arachidonic acid will become all these inflammatory mediators by COX enzyme. Hence, when you inhibit phospholipase A, all this inflammatory stuff will get reduced. Okay, that is why even it increases gastric acid secretion and peptic ulcer, because you know that prostaglandins are required for the balance, the homeostasis of GI, right? So you know how all these work out. Immunological and allergic response, they are all suppressed. So immunological competence is impaired. The recruitment again here is limited, and also inflammatory response, pro-inflammatory substances are less. Suppression is more for cell mediated immunity. That is why you are giving it before organ transplant and also after that for maintenance. So T cells which are primarily involved in cell mediated injury, cell mediated immunity, all those are suppressed. So delayed hypersensitivity is suppressed, graft rejection is suppressed. Okay, so those were the actions of glucocorticoids. Okay, see you, bye bye.